How to survive a heart attack alone after 67 life-saving tips every senior must know. What if the pain strikes when no one's around? No neighbors, no phone in your hand, just you and a racing heart. It's 6:30 a.m. The house is quiet. You're reaching for your morning tea when something shifts tightness in your chest, a strange heat in your arm, a wave of dizziness. You sit down hoping it'll pass. But deep down, you know this isn't just fatigue. For thousands of older adults, this exact moment is real and often fatal. Heart attacks don't always roar. Sometimes they whisper, and when you're alone, every second you hesitate could cost everything. But here's the truth, you're not powerless. In this video, I'm going to walk you through 7 critical, science-backed actions that could save your life if a heart attack hits and no one is there to help. These steps are simple, doable, and proven to make the difference between survival and tragedy. So stay with me, because what you learn in the next few minutes might be the reason you see another sunrise. And hey, if you find this helpful, just tap subscribe and hit the bell. That way we can keep bringing you life-saving knowledge week after week. Part 1. Know the invisible warning signs. Let's begin with the single most important truth about heart attacks. They don't always come with drama. In fact, many of them begin quietly, especially in seniors. No chest grabbing, no screaming, no collapsing, just a slow, creeping discomfort that's easy to dismiss. This is where many lives are lost, not on the operating table, but in the hesitation. When older adults feel just a bit off, many decide to wait. They don't want to cause a fuss. They think it's indigestion, or fatigue, or just aging. But when it comes to the heart, those first 5 minutes are everything. According to the American Heart Association, nearly 50% of heart attack deaths happen before the patient even reaches the hospital. Why? Because the signs are ignored, delayed, or misunderstood. The early signs can be subtle, even deceptive. You may feel a strange pressure, not pain, but pressure in the center of your chest. It might radiate to your jaw, shoulder, neck, or back. In women and older adults, symptoms may appear as nausea, sudden fatigue, lightheadedness, or even shortness of breath at rest. In fact, in a landmark study from the National Institutes of Health, over 40% of heart attack survivors reported they didn't feel any classic chest pain. Their warning signs were silent and scattered like a puzzle no one solved until it was almost too late. So how do you know when to act? You listen to the whispers, that moment of discomfort, that sense of unease in your body, that voice inside saying something's not right. Those are your signals. They are your first lifeline. And if you've ever had high blood pressure, diabetes, high cholesterol, or a family history of heart disease, your risk is higher and your margin of error is smaller. Take Richard, 74, a retired electrician from Ohio. One morning, while tying his shoes, he felt an odd tingling sensation in his left arm. He didn't collapse. He didn't feel pain exactly. But he remembered an article his doctor gave him. So he sat down, called 911 and chewed an aspirin. That decision saved his life. His doctors later said that if he'd waited 15 more minutes, the damage to his heart could have been irreversible. What saved Richard wasn't luck. It was awareness. If you're watching this now, promise yourself this: the next time something feels off, really off, you won't ignore it. You'll stop what you're doing, breathe, and take action. Because as we move into the next part, you'll see how that first signal leads directly into your next step. And that step could be what keeps your heart beating. Part 2, call for help immediately, even if you're not sure. The truth is, most people don't call 911 the first moment they should, especially seniors. They hesitate, they second guess, they wonder if they're overreacting, or they try to wait it out. But here's the brutal reality: hesitation kills. In a heart attack, every minute that passes without treatment increases your risk of permanent heart damage or death. Building off what we just explored, the subtle signs, the internal whispers, It's now critical to understand the next move. You must call for help immediately. Even if the pain isn't overwhelming, even if you're unsure it's a heart attack, because emergency services are trained to respond to uncertainty, they'd rather show up for a false alarm than arrive too late to save a life. According to a CDC study, only about 27% of people experiencing heart attack symptoms call 911. That's less than a third. The rest either wait, call a family member, or try to drive themselves to the hospital. But if your heart is already struggling, driving can be deadly. You could pass out at the wheel, endangering yourself and others. Even asking a friend to drive delays critical treatment. Emergency responders don't just provide transport. They bring life-saving equipment, oxygen, medication like aspirin or nitroglycerin, and in severe cases, a defibrillator. More importantly, they begin treatment the moment they arrive and alert the hospital so the cardiac team is waiting for you. This can shave off 15 to 30 minutes of delay, which could mean the difference between recovery and permanent disability. Let me share the story of Linda, a 78-year-old widow who lives alone. One evening, while watching TV, she felt a strange ache in her upper back and a wave of nausea. Her first instinct was to call her daughter, but then she remembered what her nurse once told her. Call 911 first. Talk to family later. That moment of clarity saved her. By the time paramedics arrived, her symptoms had escalated, but because she acted quickly, they were able to stabilize her before major damage occurred. What makes Linda's story powerful is how ordinary it is. She didn't collapse. She didn't even feel chest pain. But she trusted her instincts and chose action over doubt. That's the mindset we must all cultivate, especially when we're alone. If you live by yourself, take a moment today to learn how your phone's emergency system works. Most smartphones allow you to call emergency services with just a few taps even when the screen is locked. Some devices even allow voice commands. So if you can't reach your screen, your voice can still call for help. Preparation is protection. Make sure your emergency contacts are up to date and visible. Consider writing them down and placing them near your phone or on your fridge, places EMTs are trained to check. And if you live in a building with a buzzer, security gate, or elevator, be sure you've planned how emergency teams will access your space. This isn't paranoia, it's wisdom. Because when your heart is in crisis, the seconds you save by acting without hesitation could mean decades more with the people you love. And once that call is made, you've already taken one of the most powerful steps to survival. But what comes next is just as critical. Because the next few minutes, how you act, where you move, what you do or don't do can either help your heart or hurt it further. Let's talk about the next step, the power of aspirin, and how one small pill can slow a heart attack in progress. Part 3, chew the right aspirin at the right time. So you've called for help. That alone puts you ahead of the curve. But now comes a move that could buy you the time your heart desperately needs. Chew a plain aspirin. Not swallow it, not wait for someone to bring it. Chew it right away. This step is backed by decades of cardiac research and recommended by the American Heart Association as part of early heart attack response. Why? Because most heart attacks are caused by a clot blocking blood flow to the heart muscle. Aspirin helps by thinning the blood and slowing the clot's growth. In some cases, it even begins breaking it down slightly. That's not a cure, but it's a pause button. It helps oxygen keep moving while you wait for emergency care. Here's what matters most. Don't reach for aspirin-coated tablets. Go for plain, immediate-release aspirin, ideally 325 mg. Chewing it speeds absorption into the bloodstream, which can start thinning the blood in as little as 5 minutes. Swallowing a coated version may delay that effect by up to 30 minutes. And in a heart attack, 30 minutes could be the window between life and permanent damage. Let's ground this in real life. Joe, a 72-year-old retired teacher from Michigan, began feeling pressure in his chest that spread up to his jaw. He remembered hearing that aspirin could help during a heart attack. Luckily, he kept a small bottle in his kitchen drawer. He chewed one tablet, sat down, and waited calmly after calling 911. The ER doctor later told him that simple action may have prevented irreversible damage to his left ventricle. This isn't a one-off story. In fact, a large study published in the Journal of the American Medical Association found that early aspirin administration during a heart attack reduced the risk of death by nearly 23%. That's nearly a quarter of cases where outcomes improved, all from a small, inexpensive pill. Now ask yourself, do you know where your aspirin is? Can you get to it in under 30 seconds? Because when panic sets in, the last thing you want is to fumble through cabinets. Store plain aspirin in your nightstand, your kitchen, your purse, and your car. Make sure anyone who checks in on you knows where it is, and replace it if it's expired. While expired aspirin isn't dangerous, it may not be as effective if you're concerned about taking aspirin on an empty stomach or while feeling nauseous. Remember, this stomach discomfort is secondary. In a heart attack, the priority is preserving heart tissue. Your heart doesn't care if your stomach's upset. It cares whether it gets oxygen. There's also a psychological benefit. That small action chewing aspirin gives you a sense of control in a terrifying moment. It tells your body you're not giving up. You're fighting back. Once you've taken the aspirin and are waiting for help, the next step is one most people never think about, but it's equally crucial. You must protect your heart by doing absolutely nothing. Stillness isn't weakness. It's a form of survival. In the next section, we'll explore how staying still could be the difference between recovery and collapse. Part 4, stay completely still. When doing nothing saves everything. Once you've called emergency services and chewed aspirin, your next move is not a move at all. You stop completely, because the less you do now, the more strength your heart retains. In the critical minutes during a heart attack, unnecessary motion can worsen damage or even push your heart into full failure. This may feel counterintuitive, especially for those used to pushing through discomfort. Seniors often try to shake it off or just lie down for a minute. But movement increases your body's oxygen demand, which in turn forces your already struggling heart to work harder. That extra strain could mean the difference between a moderate event and a catastrophic one. The ideal position is upright, seated in a sturdy chair or against a firm surface like a wall or headboard. Keep your feet flat on the floor and arms relaxed at your sides. Don't lie flat unless you're faint or dizzy in that case. Lie on your left side with your head slightly elevated. This position improves circulation and helps prevent choking if nausea hits. A study from the European Society of Cardiology confirms that remaining still during acute cardiac symptoms reduces the risk of arrhythmias and sudden drops in blood pressure. Staying still gives your heart the calm environment it needs to keep functioning while emergency help is on its way. Take Alice, an 81-year-old grandmother from Illinois. While preparing breakfast, she felt a heavy pressure press across her chest and began to sweat profusely. Her instinct told her to finish cleaning up before calling anyone, but she paused, remembered her doctor's words. Stop, sit, wait, and followed them. When paramedics arrived, they found her stable. Her cardiologist later told her that the simple act of not moving prevented her from going into shock. Stillness in this moment is more than physical. It's a mental choice to prioritize survival over pride or habit. It's hard to feel helpless. Many seniors feel guilty or embarrassed, fearing they're causing a fuss. But the truth is, taking action by staying still is one of the most powerful decisions you can make. It's not giving up. It's giving your heart a fighting chance. Now is also the time to mentally scan your space. Is there anything nearby you can use for support? Are there obstacles between you and emergency responders? If you're able and safe, you might take a moment, just one, to unlock your door, but only if you can do so without straining. If you're unsure, stay seated and communicate clearly with dispatch. This phase is about control, not of your environment, but of your body's energy. Every heartbeat counts. The fewer you waste on movement, the more you preserve for recovery. As we move into the next section, we'll explore something deceptively simple but critical: accessibility. Your ability to be reached quickly by emergency responders could be the single barrier between you and life-saving treatment. A locked door, a confused address, or an unreadable unit number might add minutes you don't have. Let's talk about how to make sure nothing stands in their way. Part 5. Unlock access. Remove every barrier to help. After you've called for help, chewed aspirin, and sat still, there's one more life-saving step that often gets overlooked. Make sure emergency responders can get to you fast. If your door's locked and you lose consciousness before they arrive, precious time could be wasted trying to break in. Every second matters. According to emergency medicine studies, delayed access to patients just by a few minutes can significantly reduce survival rates in cardiac events. EMTs can't begin treatment if they can't reach you. And during a heart attack, even 3 to 5 minutes can mean the difference between recovery and irreversible damage. If you're able to move without worsening symptoms, take a moment to unlock your front door. That simple action could save your life. It's not about being dramatic. It's about giving responders the fastest path to care. If unlocking the door isn't possible, use your phone to clearly explain your location to the dispatcher. Tell them which room you're in, what the house looks like from the street, or how to get past any building gates or codes. Clear information speeds up response. For added safety, consider installing a lockbox with a spare key and sharing the code with local EMS. Or, if you're tech-savvy, a smart lock system that allows remote or emergency access is a great investment, especially if you live alone. Think of this step as part of your emergency routine, like keeping aspirin nearby or setting up medical ID. Ensuring responders can reach you without delay is one more way you take control when seconds matter most. In the next section, we'll look at how the phone already in your hand can do more than call for help. It can give responders your medical history, keep your hands free, and even speak for you when you can't. Part 6. Use your smartphone as a lifeline. By now, you've called for help, taken aspirin, stayed still, and ensured access to your home. But there's one more tool that could speak for you when you can't: your smartphone. Used properly, it becomes a vital ally during a heart emergency, especially if your condition worsens before help arrives. Start with speaker mode. The moment you connect to 911, put your phone on speaker. This frees your hands and lets you stay in a safe position, no need to grip or hold anything. More importantly, if your condition declines and you can't speak, dispatchers can still listen for breathing, background noise, or even silence. These cues help them assess how serious the situation is and guide EMTs accordingly. Now consider your medical ID. Most smartphones have a feature available even from the lock screen that stores your health information: medications, allergies, conditions like diabetes or heart disease, and emergency contacts. It only takes a few minutes to set up, but it can save hours of guesswork in a crisis. Think about Susan, 79, who passed out shortly after calling 911. Paramedics found her phone, accessed her medical ID, and instantly learned she had a penicillin allergy and was on blood thinners. That information directly shaped her treatment and may have prevented a serious error. Even better, you can add instructions or notes in your medical ID, like spare key in lockbox near back door, or call daughter first. It's like having a voice, even if you're unconscious. Take 5 minutes today to activate these features. Practice using speakerphone. Fill in your medical ID. Make it visible from the lock screen. It's a simple step with enormous value. In our final section, we'll focus on the one action that can ground you in the middle of chaos: your breath. When panic rises and your heart pounds, how you breathe can help you stay conscious, calm, and in control. Let's explore how breath becomes your anchor. Rena duwan for Tornashorin Tomawun. Part 7. Control your breathing to stay conscious. During a heart attack, fear can take over fast. Your chest tightens, your thoughts race, and panic floods your system. This fight-or-flight response releases adrenaline, which speeds up your heart rate and raises blood pressure, exactly what your heart doesn't need right now. But there's one thing you can still control: your breathing. Calm, intentional breathing helps slow the stress response. It activates your parasympathetic nervous system, the part of your body that promotes rest and recovery. This doesn't stop a heart attack, but it can help you stay conscious and stable while you wait for emergency care. Try this simple technique Inhale slowly through your nose for 4 seconds. Hold for 1. Then exhale gently through your mouth for 6 seconds. Repeat. Focus only on the rhythm. The goal isn't deep breathing, but steady, controlled breaths that keep oxygen flowing and your mind from spiraling. This approach helped Frank, 83, who experienced chest pain one morning while home alone. Instead of panicking, he sat upright, focused on his breath, and counted each inhale and exhale. When EMTs arrived, he was still alert and able to speak clearly because he stayed calm when his body wanted to shut down. Practicing this breathing technique now, in moments of calm, makes it easier to access during stress. Try it when you wake up, during quiet moments, or anytime you feel overwhelmed. The more familiar it becomes, the faster you'll use it instinctively. With this final step, you now have a full toolkit. Recognize the signs. Call immediately, chew aspirin, stay still, unlock access, use your phone wisely, and control your breath. Now, let's bring it all together in one closing message to remind you why these steps matter and how they could be the reason you survive the unthinkable. You've just learned 7 critical actions that could save your life if a heart attack strikes while you're alone. Not someday, not in theory, but today, in real time, when every second matters more than ever. These aren't complicated medical procedures, they're practical, powerful choices that any senior in any home can make. Recognizing subtle symptoms, calling for help without hesitation, chewing the right aspirin, staying completely still, ensuring responders can reach you, using your phone not just as a tool, but as a voice, and anchoring yourself through steady, focused breathing. Every one of these steps works together to do one thing: buy your heart the time it needs to keep beating. Many people think emergencies are unpredictable, but the truth is, preparation makes the difference. It gives you power. It turns panic into action. And most importantly, it reminds you that you're not helpless, you're ready. So take a moment now to act. Place aspirin within reach. Update your medical ID, practice calming your breath, and share this knowledge with someone you love, because you might not be the only one who needs it. If this video opened your eyes, comment below with what surprised you most. Tell us which step you're going to take today. Your story might be the one that helps someone else survive tomorrow. And if you want more life-saving insights delivered clearly, calmly, and with care, tap subscribe and turn on notifications. We're here every week with science-backed tips designed to help you live longer, live stronger, and live with peace of mind. You deserve to feel safe, to feel prepared, and above all, to keep living the life you love. Stay aware, stay ready, stay alive. We'll see you in the next video.